Again, my name is Colonel Matthew Packard. It's my honor to serve as the Chief of the Colorado State Patrol. And it's, again, Colonel Matthew Packard, P-A-C-K-A-R-D. Well, I wanted to take a couple of minutes today to talk about a couple of things. First and foremost, the crisis that we're experiencing not only here in Colorado regarding fentanyl and how it's pervasive across our communities statewide. This is not economically driven. This is in quite literally every neighborhood, every community across our state. And because it's so pervasive, this needs to be a true system-wide approach to combat this problem. And that's why I'm so thankful to be here today with our partners from the federal and local government, because it's going to take the totality of the judicial system to address this issue, but also the totality of our communities. Again, this is pervasive. And I will start here. If you are addicted to fentanyl or an opioid or drugs, or someone that you love or care about is addicted to this drug, you have no more wiggle room. The time to act is now. This is an urgent issue that if you are interested in saving the life of someone you love about or yourself, you need to act today. And the only way we're going to be successful in combating and oppressing this issue is if it is truly every single one of us that are engaged in the fight. It is everywhere. This is not a drug that is made carefully. This is a drug whose makers, whose manufacturers are interested in being more quick, more efficient, so they can make more money off of your addiction. They are not worried about the quality or what it's going to do to you. So it truly is our shared responsibility to make sure that we're addressing this as quickly and as formally as we possibly can. So I want to talk a little bit about what we're doing here at the Colorado State Patrol before I turn it over to our partners. This is the priority of our interdiction efforts. Every day our state troopers are out working on Colorado's highways looking for people that are transporting this drug and others into the state of Colorado. In 2021, we saw sharp increases in firearms and in drugs across all categories that are being transported and smuggled into and through Colorado. This is to the detriment of public safety in Colorado, not only for the drug user, but for the person sitting next to the drug user, to your neighbor, to the whole community. This is a problem. And our seizures are only going up. Let's talk specifically about fentanyl. It is now June 1st, and we have seen about 225 pounds of fentanyl. We talk about how deadly it is, and we're talking about the top of a pin. 225 pounds year to date that Colorado State Troopers have taken out of cars being smuggled into Colorado. That's coming to this community. That's coming to a community anywhere where you live. That's where it's coming. And it's only getting better, or only growing. In fact, last year we only had about 150 pounds. We saw about a 50% increase in the fentanyl that we're finding. By way of perspective, in 2019, troopers found 11 pounds. So it's coming more rapidly. It's coming because there's a demand for it. And we need to work together to solve that demand. And I will assure you that our troopers will continue to work exceedingly hard to pull it out of the system, to take it out of your neighborhoods. And let's hear about our partners as well. And with that, I'll turn it over to Keith Weiss from the Rocky Mountain HIDA.
Thank you, Colonel Packard. My name is Keith Wise. I'm the Executive Director of the Office of National Drug Control Policies, Rocky Mountain HIDA, High Intensity Drug Trafficking Area Program based here in Denver, Colorado. First off, I want to say when we analyze data that indicates increases in drug seizures and dramatic rises in fatal overdoses, it becomes alarmingly apparent that the user market for illicit fentanyl in the state is expanding. To save lives, a unified response between public safety and health professionals will be essential to countering this dangerous trend. There's a national drug crisis in this country that, according to the CDC, has claimed more than 107,000 lives over the last 12 months, and this number is expected to rise. In 2021, nationwide fatal drug overdoses rose 15%, while unfortunately, Colorado experienced an increase of approximately 26.5%. Nationally, it's estimated that over 70% of all opioid-related deaths can be attributed to illicit fentanyl. The Rocky Mountain HIDA is proud to partner with and support Colorado law enforcement agencies such as the Colorado State Patrol, other statewide multi-agency task forces, and the U.S. Attorney's Office in this effort to protect our communities by interdicting shipments of illicit fentanyl entering Colorado. Our data indicates that HIDA Support Task Force has seized 331% more illicit fentanyl in 2021 than the previous year of 2020. Combined powder and lace pills totaled more than 1,657,249 dosage units that never made it to the streets. This number is really staggering when you consider it only takes one dosage unit to take a life. Alarmingly, almost as much illicit fentanyl that was seized in 2021 has been interdicted in only the first 4 months of this year. A preliminary total of 2,084,633 dosage units have been seized, which is at least a 394% increase over this time last year. And we expect this number to dramatically rise over the course of 2022. Concurrently, it's also expected that the numbers of fatal drug overdoses related to fentanyl will climb well beyond the numbers reported by CDPHE in 2021. What we can deduct from this seizure and overdose data is that the market for illicit fentanyl in Colorado is expanding, and sadly, when more of this drug is made available, fatalities will follow. Just like to briefly mention the charts that we have over here to your left, CDPHE's drug overdose data from 2017 to 2021. As you can see, there's a dramatic increase in Colorado of fatal overdoses. The total in 2021, which is 905, is a very key number. CDPHE reported just under 1,200 opioid-related overdose deaths in the state of Colorado for 2021, which 905 of them were fentanyl-related, illicit fentanyl-related, meaning over 80% of these deaths were caused by illicit fentanyl. The next chart you see here from 2018 to 2022 to this date shows you the increase of fentanyl seizures that have been made by public safety in Colorado over the last several years. As you can see, in 2018, like the Colonel mentioned, only 4,100 dosage units were seized by law enforcement. This year alone, in the first 4 months of the year, we're up over 2 million dosage units, which is a staggering increase for Colorado. The last board you see here are just 2 seizures that kind of typify the types of shipments that are coming from out of the state of California into Colorado for distribution. One is made by the Colorado State Patrol, over 131,000 dosage units on March 18, 2022. Another seizure made on April 4th, 2022 by the Front Range Task Force here in the Denver metro area, which was over 130,000 dosage units. We must muster all available resources to counter this growing threat. This will take a concerted effort and partnership between both public safety and public health professionals moving forward. Over the last year, the Rocky Mountain HIDA has partnered with the CDC Foundation under ONDCP HIDA's National Overdose Response Initiative to bring together public safety, prevention, and treatment specialists for the purpose of collaboration, information sharing, and providing opportunities for specialized training that's mutually beneficial to all agencies engaged in protecting our communities from the harmful impacts of illicit fentanyl. Collaboration and information sharing includes initiatives such as the increasing participation in a national overdose mapping system, ODMAP, by public safety and health agencies. It'll be these valuable partnerships and goals of protecting our communities that will be the recipe for success. On behalf of the Rocky Mountain HIDA, I want to commend the outstanding results and noteworthy teamwork of our state's law enforcement agencies in the monumental task of slowing down the flow of this deadly narcotic. Every dosage unit that does not make it to market potentially saves a life of a loved one here in Colorado. I'd now like to introduce Assistant Special Agent in Charge, Lenny Carrillo from the Federal Bureau of Investigation.
Good morning, my name is Lenny Carrillo, C-A-R-O-L-L-O, and I'm the Assistant Special Agent in charge of the Criminal Branch for FBI Denver. 2 of the FBI's highest priorities are combating significant violent crime and combating transnational criminal enterprises. As we have seen nationally and here in Colorado, there is a definite correlation between violent crime and transnational criminal enterprises. Violent criminal actors are engaging in violent activities to fuel their drug addictions, and transnational criminal enterprises are involved in crimes of violence in furtherance of drug trafficking. Over the last 6 months, FBI Denver has recovered over 28,000 fentanyl pills during the course of criminal investigations throughout the state. While one of our priorities is disrupting the drug trafficking organizations who are responsible for the distribution of these deadly pills, both here and abroad, we also recognize these lethal drugs are here, and sadly, we cannot stop all of them. Through our partnerships with federal, state, and local law enforcement agencies, including the agencies represented here today, the FBI remains committed to combating the deadly threat posed by fentanyl and other lethal drugs in our community. These illegal drugs are fatal, and they are responsible for the countless deaths of our neighbors and our children in communities throughout our state. To combat the narcotics supply stream in our state, the FBI's Denver Strike Force Group is one of 19 such entities in the country that intertwines FBI special agents with other federal partners and local task force officers to target drug traffickers, whose deadly criminal enterprises have ties across the United States and in other countries. The FBI will continue to use all resources necessary to combat the scourge of these deadly drugs and will work with our partners to protect our citizens from harm. I'll now turn it over to the United States Attorney for the District of Colorado, Cole Finnegan.
Good morning. Thank you for being with us. I'm Cole Finnegan, C-O-L-E-F-I-N-E-G-A-N. I'm the United States Attorney for the District of Colorado. Before I start, I'd like to thank again our partners in local, state, and federal law enforcement. Their work is so critical to our work in the U.S. Attorney's Office, and without their persistent, dedicated efforts, we would not be able to move forward against the criminals who manufacture, distribute this deadly poison that's killing our neighbors, killing our citizens, and killing our children. Let me start by saying fentanyl is a life-threatening crisis, as so much of this drug floods our state. The trend is not slowing down. That's why we are applauding the work of our partners at the local, state, and federal levels to stop this drug. As you've heard, our partners are removing millions of counterfeit pills laced with fentanyl from our streets. But the drug traffickers are still pushing incredible amounts of fentanyl into our state. Fentanyl is still widely available, prices are dropping, it is easier and cheaper than ever to get. And that means more and more people are at risk in our state. Sadly, the demand continues, even though it is killing people. Collaboration among federal, state, and local partners on prevention, interdiction, and prosecution is critical to effectively cutting off or hindering the supply chain. Our intelligence analysis shows Mexican and Chinese criminals are working together to manufacture and distribute fentanyl and facilitate criminal activity. The U.S. Attorney's Office is prioritizing the prosecution of fentanyl. In 2021, our office obtained 50 indictments on fentanyl-related crimes, compared to 21 in 2020 and 13 in 2019. This increase is even more striking when you compare it to indictments on heroin-related crimes, which stayed relatively stable over the same 3-year period. Last year, our office obtained the first federal conviction in the state's history against a drug dealer for causing an overdose death after selling fentanyl-laced pills. We now have charged 14 defendants with similar crimes. But let me just say again, it's not just about prosecution. It's also about education. Public awareness and messaging is important to help prevent a first-time user from becoming a victim. Please don't buy any drug off the street. Only take drugs you get from a pharmacist. Anything else could contain fentanyl, and it could kill you. So with that, let me stop, and we'll take any questions that you have. Yes?
You show us how much you've seized. Do you have any idea or estimate of pound or dosage units that are making it into Colorado that are not seized?
I'm going to turn to one of our partners to see if any of you have any answer to that.
Historically, law enforcement has only taken off a percentage of total narcotics that have flowed into an area. What's alarming about these numbers, they're so high, and they're just, like I said, 394% increase this time right now as compared to last year. So it's really hard to tell how much is coming in, but we do warn everyone, and we want to get the word out, especially on the fentanyl, that because there's such a user base out there, this drug seems to be preferred more and more by customers. So we assume that once the market is, the market will demand how much of the narcotic comes up. So you know, it's hard to say exactly what the percentages of narcotics are seized that are making it this way. We can only assume that a lot of the narcotics are making it through. Obviously, people are dying, and the overdose numbers continue to rise. So it alarms us that that much fentanyl could be coming into Colorado.
Can I just add to that really quickly, just for a matter of perspective? So in 2021, and this is just the State Patrol, so we're one of many partners involved. In total, we seized about 2 tons of illicit drugs off straight coming out of cars that are being smuggled into Colorado. 2 tons. And when we talk about the growth of fentanyl alone in 2022 compared to 21, the criminal organizations that are making this substance and sending it through Colorado are in this business for one reason, and that's to make money. And when I can take off 2 tons of their product and they're still coming, that should be an indicator that they're still making a lot of money, because that's their profit drive. So we are doing everything we can, but it is truly a drop in the bucket. And that's why it's so important that we all have to drive this demand down. It's a drop in the bucket, and it's not fun to say that, but that's the God's honest truth. We got a lot of work to do.
And as a follow-up to that, when you say we all have to drive that demand down, is that through harm reduction practices? Like, are you talking, you're looking more at the community versus what you can do? Because you said it's a drop in the bucket.
Yeah, I think it's inclusive. I think it's all of those things. I don't know that anybody that tells you there's one solution to this problem, they're dreaming. I think it's collaborative law enforcement efforts, it's harm reduction, it's community engagement, it's caring about your neighbor. It's all of those things are the only way we're going to be successful about this.
I saw a question over here.
A weird question. They were curious. We appreciate how much you're getting off the streets with this deadly drug. How are we safely disposing of all of this and making sure it doesn't get back on the streets and getting away from people?
I'm going to once again see if any of our partners have an answer on that.
Generally, any evidence is seized off the street is obviously held for prosecution purposes, and once the prosecution has run its course, the evidence is usually disposed of. In many cases, they burn it.
Yes, ma'am.
Obviously, you're approaching distribution and getting people who are bringing it into the state, and you mentioned getting people who are dealers and convicting them more. How are you getting to the dealers more often? Seems more often now.
Well, that's a great question. And the point I want to make is we're focused in the United States Attorney's Office on really going after and prosecuting the people who make the drugs and the people who distribute the drugs. And we look at each case as it comes in. We talk to, obviously, our law enforcement partners, both local and federal and state. We determine what charges are applicable, and we determine, at what level these people are manufacturing or distributing drugs. And the point I want to make, under the federal law, fentanyl is a controlled substance. We have the ability under federal law to charge and prosecute anyone who's in possession of fentanyl or distributing fentanyl. And if that distribution of fentanyl results in the death of someone, and we can link that to that person's death, that victim's death, then we will move forward with charges of no less than, you can be charged with no less than 20 years up to life in prison. So that is how we move forward. But I think all of us, we're really focusing on trying to stop the people who are distributing this, because they are literally killing the citizens of our state. Yes, ma'am.
I know speaking with local, counties, and there's been talks that there isn't enough to really charge people. How do you feel like, you said there was new charges last year, you've done 14. Is it enough to hold these people accountable, or does more need to change?
Well, what I will say is, again, under the federal law, fentanyl is a controlled substance. And we can move forward with charges, and we can prosecute people for distributing fentanyl and for holding fentanyl, and we will do that. And I think all of us up here are dedicated to stopping it. I think we can always do more. I think we all understand that we're really fighting against a terrible, terrible enemy here, but we'll continue that fight. Yes, thank you very much. I would also note that there's a fentanyl summit, beginning tomorrow morning. It's co-sponsored by Brian Mason, the district attorney in Adams County, and John Kellner, the district attorney in Arapahoe County. It will go on all day tomorrow at the Denver Art Museum, and then half the day on Friday. I know Mayor Hancock will be there, Attorney General Weiser, former U.S. Attorney and current Colorado Springs Mayor John Suthers, and myself. And then we will also have a number of people from local, state, and federal law enforcement speaking at that summit tomorrow. Thank you. Yes, ma'am.
With fentanyl being so hard to identify and knowing it's in so many different drugs, have your seizure practices changed because of that?
Well, I'm going to turn that over to one of the people who sees it.
It's a great question, and actually one we were talking about right before we came out. So there's a bit of a misnomer. Fentanyl comes in a lot of different shapes and sizes, and we have certainly, when you're taking a drug, when you buy, whether it's meth or illicit marijuana, there's a good chance today that there's fentanyl inside of that substance as well, and that's been much talked about, and that's a risk. And so as far as when we're seizing it on the side of the road, we take every safety protocol we can to keep our troopers, our dogs, all of those folks safe so they don't get sick by becoming into contact with this. But the part that people are missing is folks are intentionally taking fentanyl right now as well, in pill form, where they're coming in because of the characteristics of that drug. And so all of it from a seizure perspective is we have to be very, very careful. To give you an idea, back in the day when I was working the road, you find a load of dope, you put on some gloves and do a quick test and go about your day. And that's not the case anymore. When we find a major seizure, we're using hazmat teams at times to test this stuff because it's so volatile and it is such a risk to the safety of for our first responders. And imagine the people that are taking that on the street and you just don't know what's in it. A pill could be empty, right? It could have almost nothing, and it could be pure, straight fentanyl as well. That's the quality control of this stuff is dangerous, and we got to treat everything like it's going to kill you by touching you.
Just to follow up on that, can you elaborate more just on other ways you're changing the CSB's response? Are you allocating more staff to this work? Are you putting more funding toward it? What are some of those concrete changes you're making?
I will just tell you from the State Patrol's perspective, we continue to work really closely with our federal partners, engaging in task forces, trying to work at the higher level organized crime case, much like the U.S. Attorney said. Our focus is on impacting the higher level folks. We're trying to stop it at the distribution level, and if we can work it back to the manufacturer level, then that's where we're focusing our efforts. On the street, we're finding different ways, different task forces to engage in. We've got a dedicated team of troopers that drive cars that look just like this, that are out there looking quite literally every day. We got all kinds of problems to solve, and this is one of those things, and so we put as many resources on it as we can. But I'll tell you, it's 100% collaborative. We don't do anything by ourselves. It's with everybody that works at the Department of Justice is part of this fight as well.
Thank you so much for being here with us today. Our plan is later today to tweet out some additional video. Colorado State Patrol allowed us to come out earlier this week and videotape some of their training that they were doing with their canines. And so we're going to get that out on Twitter on the U.S. Attorney for the District of Colorado's page later today. Thank you so much for being with us, and let me know if you have any additional questions.
Can I ask one more question? Can you talk about the last seizure you made? How big was it, and what did you learn from it?
I'm sorry, I didn't hear the question.
Can you talk about the last fentanyl seizure you made and what you learned from it, and how that illustrates how your work is changing?
Context, I don't know that I know about our last seizure yet, because it probably just happened. I mean, this is happening, if not daily, it's happening weekly. But it's difficult to talk in specifics, because there's so much of it coming that if I can have a trooper that's trained in criminal interdiction out on the road, I can almost guarantee you that day they're going to find a load, because it's there, and it's just volume. So the lessons that we're learning, it's about volume. It's there in as many resources as we can all put at this problem. We will be successful in finding it.